I don't know, for myself, like every once in a while, you'll just like sit when you're quiet and you're like, I just can't even believe where I'm at, you know. This little girl that was raised in Iowa, and to achieve what I've been able to achieve and be part of what I've been able to be a part of is just mind-blowing to me. Here's my first ID from DMU.
Dr. Carla Stubbins has worked for over 30 years in healthcare higher education. She's led MHA programs at both DMU and Rochester Institute of Technology, guiding each to achieve specialized accreditation with the Commission on Accreditation of Healthcare Management Education, or CAME. Stubbins was named a CAME Fellow in 2017. She's currently a Program Director of Graduate Programs in Healthcare Administration at Texas Women's University.
That's me, my first day at DMU. Oh, there you go.
Before she even graduated in 1993, she was already working as staff in the MHA program.
I had no idea health administration was what I wanted to do, but I always had thought that being an educator sounded kind of fun to me, so.
She would stay at DMU for the next 23 years, transitioning up to faculty and eventually director of the program. An ambitious culmination of her work was an attempt at CAME accreditation.
And I was super skeptical of accreditation. I thought we had a good thing. We had a good program. Students' careers were advancing, and the advisory board came back and said, we think it'd be a good thing for the program, but what you're doing is good, so you don't have to hurry. In the end, because of the process, I really came to respect the accreditation process.
That accreditation win led her to do the same thing at her next appointment at RIT. Now she's doing the same at Texas Women's.
I just enjoy fixing things. I don't but I would say that my MHA is probably the most impactful degree I've ever earned. And I'm not just saying because you're standing here, but once you see the impact on your career, I just was excited to provide that opportunity for students. When you talk about healthcare, they always think of doctors and nurses, but most of them never think that there's this whole administrative side that goes on to remove barriers and create resources, create processes that support improvement. That's what healthcare administrators do. Instead of working patient by patient, they were given skill sets that could influence entire organizations, entire populations of people.
Carla is motivated by the work, but loves the relationship aspect the most. This is evidenced by her friendship with a former student, Abby Hutchins. When they both landed in the same city, it was perfect timing.
And I said, well, I just accepted a job. And she's like, I am literally looking out my window at your building. So since I've been here, we've been meeting like monthly, just get together for lunch, walk around here. And then we had an adjunct faculty position we were looking for. So I'm like, hey, you want to teach? And so it's been fun just reconnecting.
To me, I've always thought of her as a mentor, but I also think of her, especially now so many years removed from being a student, I think of her as a friend. She had asked me once, well, what are you going to do when you're done with school? What do you want to do? Where are you going to take this? And I remember being absolutely terrified to tell her the truth, but I looked her in the eye and I said, I want your job. Lo and behold, I became a program director of a few different educational programs through the years. So,
because of things like LinkedIn and Facebook, you can just continue to watch students' careers. For 20, 30 years, you watch them grow. So to know that you've had that impact, it just makes it all worthwhile. So.